I'm so pleased to see so many people here, and it's just my honor and privilege to welcome you. My name is Dr. Jennifer Tupper, and I'm the new Dean of the Faculty of Education here at the University of Alberta. And I want to welcome you on behalf of FNCARES and the Faculty of Education to this excellent talk that Cindy and Alika are going to be doing shortly. I want to start us off in a good way by acknowledging that we are on Treaty 6, the territory of diverse Indigenous peoples, including the Cree, the Blackfoot, the Nakota Sioux, the Dene, and the Métis people of Alberta. Treaties are an important part of our past, but more critically, a part of our future. And it's important to acknowledge the land. Indeed, it is the very least that we can do on this shared territory. I also want to thank our co-sponsors for this event, the Office of Safe Disclosure and Human Rights and the Division of Community Engagement, Faculty of Medicine and Dentistry. We couldn't be having this event without their support, so a public acknowledgement of that. And I also have the privilege of introducing the amazing Charis Auger. Where is Charis? Right there. Okay, I'm going to say a little bit about Charis first, and then I'm going to hand the mic over. So Charis, whose preferred pronouns are they, them, is a two-spirit mother from the Big Stone Cree Nation who's committed to Wissakichang through institutions in order to support safer spaces for the next 7 generations and to create spaces for two-spirit youth to achieve everything that they were told they could not have as Indigenous young people. They are an alumni from the University of Alberta and graduated with a Bachelor of Arts in Native Studies with a certificate in Aboriginal Governance and Partnership. Currently, they work with Where the Rivers Meet program at the Institute for Sexual Minority Studies and Services to uplift and empower two-spirit youth through community-based healing workshops. So please join me in acknowledging Charis.
Tanse. My name is Charis Auger. I do not have a, that's fine. That's a colonial last name, don't worry about it. I do not have my spirit name yet. However, the next time I speak in front of you relatives, I will have my spirit name and I will be able to introduce myself that way. So we recognize the Institute for Sexual Minority Studies and Services is located on the Treaty 6 territory. We are grateful to be on Blackfoot, Cree, Dene, Nakota Sioux, Saulteaux, and Métis Nation territories, specifically the ancestral space of the Papasches Cree. These nations are our family, friends, and fellow queer and trans people. As long as the sun shines, the waters flow, and the grass grows, we will honor the nation-to-nation treaty relationship. We believe in holding up the resistance of Indigenous peoples and the voice of queer, trans, and two-spirit Indigenous folks in our communities. We are always striving to support anti/decolonial initiatives and moves towards reconciliation and sovereignty. So, hello, I'm very honored to be here today. I needed to offer a counter land acknowledgement. As individuals, we have a choice on how we choose to acknowledge the land, and I chose today to acknowledge it in the way that my very sovereign relative, Charis Auger, has written. So today, we will have Dr. Alika Lafontaine come up and speak first for approximately 30 minutes, and then we'll move into Cindy, Dr. Cindy Blackstock. Cindy will then talk, and Cindy will speak for approximately 20 to 25 minutes, and then we will have time for a question or two. But just so all of our relatives are aware in this space, we do not have an open mic Q&A. However, our relative Melissa will be graciously walking up and down the aisles if you have any questions. Maybe you don't feel safe enough to ask them out loud, but you can definitely write them down on a piece of paper, and Melissa will pass them along to me. I want to let everyone know that this is a safe space, so please feel safe in doing so. So our relative Alika Lafontaine is an award-winning physician, speaker, alignment consultant, and the first Indigenous physician listed by the Medical Post as one of Canada's 50 most powerful doctors. In 2016, he won the Great Healthcare Debate on behalf of the Indigenous Health Alliance, a competition voted on by more than 700 health leaders from across Canada, aka Turtle Island. As a member of the Alliance, he works to align national medical organizations and health decision makers behind Indigenous communities to achieve practical implement of the Truth and Reconciliations Commission calls to action on health. Alika currently sits on the Council of the Royal College of Physicians and Surgeons of Canada. The Board of Healthcare Can is an elected delegate to the Alberta Medical Association and is the immediate past president of the Indigenous Physicians Association of Canada. So please, can we welcome our relative Alika Lafontaine to come and share their medicine.
All right, so if you see me looking at my watch, just because I don't want to go into Cindy's time. So I'm an anesthesiologist. I think people only know who anesthesiologists are if they go to the operating room or they have a baby. So we're sitting in training trying to figure out how exactly to communicate to people what we do in a fairly short period of time, because we don't get a lot of time before we give you the drugs to put you off to sleep. So we came up with the term medical ninja, and we thought it was pretty appropriate. So we're dark and mysterious, we're highly specialized, and we're the last thing you see before you lose consciousness. So I had a presentation put together, but I think I'm going to change it a little bit halfway, and I'm going to tell you a bit of a story. All right? So there's three questions that I wanted to look at as we went through the discussion, and once again, I'll just be checking on my watch to make sure I stay on time. The first question is, why are Indigenous patients so sick? All right? This is a question that people have studied for decades. Millions, hundreds of millions of dollars have been spent in this area. The second is, how does the health system really work, especially when it comes to Indigenous peoples? And the third, and I think is the most important one, is what can I do individually? So the first concept that's important for everyone to think about is that there's a world out there that we don't see. All right? It's not because we're not in a room full of intelligent people. It's not because we don't want to see it. It's because as we get older and we start to develop different beliefs and assumptions, we literally can't see it. And I presented this next exercise at over 100 different locations across Canada, and the results are usually pretty consistent, so we'll see whether or not they're the same today. So everybody knows what the letter F is, right? I assume? All right. So I want you in the next paragraph, I'm going to give you 3 seconds, just to count the letter F. All right? So just count the letter F in the next paragraph. I'm going to give you 3 seconds. Here we go. So read it. 1, 2, 3. So how many F's were there? All right. How many people saw 2 F's? Raise your hand. How many people saw 3 F's? How many people saw 4 F's? How many people saw more than 4? Interesting. So you can't use this exercise with grade school children because it never works. But it definitely worked today. So if you read through the paragraph, finished files are the result of years of scientific study combined with experience of years. There's actually 6 F's, all right? So the important thing isn't that you saw 3 or less. The important thing is, why did you only see 2 or 3? So the reason for that is that when we read, we're educated to believe certain things, all right? So 2 things that we're educated to apply when we read is that if we have a short period of time, focus on the big words, because we got to focus on content, right? That's the most important part of reading. Now, appreciate that when I asked you to do the exercise, I didn't tell you to figure out what the paragraph was about, all right? I just asked you to count the F's, all right? The second is that when we read, we all tend to read in our heads, all right? So as you're pronouncing the words like scientific sound very different than words like of, all right? So those are the 2 reasons why most people don't catch this. Now, these assumptions and beliefs don't really sink in until around grade 4, when most people start to get up to a higher reading level. If you get someone in grade 1 or 2 or 3, they tend to read very, very slow, very deliberately, focused on every single individual word. All right, so with kids who are in grade 4 or less, or in people who haven't gone to formal Western education, like many of our elders in our communities, this doesn't work at all right, because they never developed these rules. So next I need a helper, all right? So anybody brave enough to help out? If not, I'll just roll and tell someone. Sure, I'll have you help out. So I'm going to get you to stand right there. I'm going to put 3 triangles up on the board. I'll get you just move back a little bit just so you have a bit of a, maybe stand right there. Right there would be good. Just up on the stairs. Not on a stair, but on the platform. Perfect. So I'm going to put up a set of triangles, all right? And I want you to read what's in the triangles, but I just want you to read it fast, if you can do it fast, okay? So we're going to have 1, 2, 3, and just read it if you can project. Can you try and yell loud? Can you talk louder than that? Yes, perfect, perfect. Okay, sounds like we're ready to go. All right, so we're going to read 1, 2, 3, okay? So nice and quick, because I don't have a lot of time before Cindy comes in. So, okay, first one. Next. Next. Is that what they said? So, we'll have you take a seat. Thank you very much. That was very good. So what did they actually say? Do we have a volunteer to help us out? Did you see? Yeah, what did they actually say? All right, so this doesn't always take someone to read through quickly. I've sent this presentation over to people to go into their own slide decks, and they've actually edited this to make it look proper, right? So when you're told that certain rules exist, certain assumptions, even though you've just immediately been told that these assumptions exist, you still don't see them, all right? This is the reason why people don't see racism, this is why people don't see sexism, why they don't see classism, and why people don't see discrimination. We have these rules that we build up in our heads that makes us believe certain things and helps us filter through everything that comes through. So when we're defining the problem of Indigenous health, answering that first question of why are Indigenous people so sick, it's important to recognize that there's pre-existing ideas that affect how the system defines these problems. Many minimize the effect this may have, but if you look at clinical value streams, you take a health problem, a system solution, improvement in patient outcomes. Let's imagine that you came in and you were disoriented. All right, so in medical speak, you have an altered level of consciousness. All right, the differential of that is pretty broad. Could be a heart attack, stroke, high sugars, could have had a concussion. I could go on and on. There's probably 12 or 13 different things that you could list on here if you wanted a complete list. What often happens to Indigenous patients when they come through the emergency doors? Must be drunk, must be on drugs. And often what happens, and this is quite literal, is investigations and further workup are not done, because they say, that's just the way that it fits. And when you look at incremental equality and what's happening to our children and discrimination in all different streams, whether it's social or health or otherwise, there's these rules that we built up in our heads about what's expected. A kid on reserve is not going to graduate high school anyway, so why fight for equal funding? Families aren't able to self-diagnose, so why in the world would they have any input into how their care streams work? And there's list upon list of how these things work. So the system works when the health problem is defined properly, the system solution is effective, and measurement of those two things confirms that the patient health outcomes improve. All right? All 3 of those are usually lacking when you're looking specifically at health, and I'd expect in social, as well as education and other streams, is probably true as well. So the question that I'm going to now deviate from my presentation, because you can download it and read it through later, is why is this system still in place? Why can you not show people that there's literally these assumptions that are leading towards outcomes, that are leading to discrimination, but for whatever reason, things don't change? So as with any story, there's a certain number of rules that we have to agree on, things to kind of set the scene. In order to set the story, the first thing that we have to agree on, turn on the lights here, is that systems create outcomes. So when you decide on what you want to get, that is what the system is designed to do. When we talk about colonization, we've created pages upon pages explaining what colonization is. I think probably the fastest and quickest and clearest way to do it is to use a definition from Murray Sinclair. and that's that the intent of colonialism was to extinguish rights, specifically rights to land and resources. If you look at all of our colonial systems within that frame, it makes a lot of sense why the systems were created the way that they were. If you consider health, you don't want a healthy population because then they can express their rights. They can exercise their rights to land. If, for example, I want to take your car from you, I can do one of three things in relation to your health. I can make sure that you're too sick to ever drive it. I can make sure it's in a place that you can't access. Or I can make sure that you die. All three of those things are the outcomes of our health system. This isn't to say that people within the health system right now want these outcomes. And that's an important differentiation. I don't think anybody in government, I don't think the ministers, I don't think our prime minister wants these outcomes. But the system was created to have those outcomes. So unless we change the system, the outcomes will remain the same. Now, when we tie this back to incremental equality, whenever you incrementally change a system, just make it more efficient. You can see this in health. So we created a physician-centric system that mainly dealt with acute care. All right? If you look at the history of medical services in Canada, hospitals were really designed to be your last stop in the hopes of trying to deviate your bad health. We expected you as a patient to kind of figure things out yourself, just come if you were like near death or dying. All right? So we've never changed those system outcomes. We're trying to right now by changing the models of care, the medical home, patient-centered care, focusing on safety and quality improvement, etc. But until we change what the outcomes are and redesign the system to create something different, you're not going to have any change. So if you're speeding up things and just making a system more efficient, and it's not changing those original outcomes, you actually end up just getting it faster. So if the outcome of our systems, our colonial systems within government, is to extinguish the rights of Indigenous peoples, and is to extinguish specifically the rights to land, by incrementally changing systems, we're just making that work better. So that leads us to the second rule, that our communities are in perpetual crisis. Perpetual crisis is the desired outcome of colonial systems. You want people to constantly be in crisis. That way they can't change things, they can't fight against things, they can't exercise their rights. Perpetual crisis is different than regular crisis. Right? All of you are probably familiar with the history of the SARS epidemic that happened in Ontario, right? And the things surrounding that. When you talk to individuals who are part of that, one of the things that you hear over and over again is that the system was brought to its knees and almost broke. All right? We almost literally had the entire system of medical care break in the region of Ontario. I remember being a resident in training during the outbreak and having machines that were supposed to be used for anesthetics in the operating room transferred over to the ICU. That way we could keep people alive who had this unknown respiratory illness. We actually shut down surgeries for several days, just in case the machines were needed or because we were afraid of infection control. Imagine that happening across every operating room in every major city in the country. How often can you delay surgeries until, the ones that are kind of nice to be done now move into the ones that have to be done? People who need bypasses, people who need cancer taken out, people who need other life-saving surgeries. So when you're looking at perpetual crisis, this is crisis after crisis after crisis. For any of us who've lived on reserve or worked on reserve, we can actually see this in real time. You first have a mental health crisis where something happens at the school and there's a bunch of kids who are now depressed and saying that they're having suicidal ideation, right? And then a family member dies because they've had long-term cancer. And then a child commits suicide. And then there's a fire. And then there's another crisis and another crisis. Eventually that system will break and lose all capacity to deal with the challenges that it's faced with. So when you compare what's happening on our nations and within our communities versus what would happen in the regular medical system is actually exactly the same. If SARS had continued on or had another respiratory illness stacked on top of it or another crisis stacked on top of it, our Canadian healthcare system would be in the exact same position as where our First Nations are right now and other Indigenous communities. The third is that things must change. So we don't have a choice anymore. We have to change. The crisis has led to too much death, too much disability, too much discrimination. Our communities don't have a choice of whether or not to change anymore. So what is the story? So most of the stories in our communities always start with crisis. All right, so we can use an example from Northern Ontario with youth suicides. All right, so youth suicide outbreak began back in January. It was something that the community had actually warned the government about for several months leading up to it. All right, there are continued calls for expanded mental health services. There had been proposals submitted about expanding local health services in communities that they knew had high levels of youth who were expressing a desire to commit suicide. There was calls from physicians and health regions and territorial leadership as well as families themselves. But then the suicide crisis started to stack, and it eventually got to such a bad crisis that the nation started to notice. Right? So these crises, they're always there in our communities, but every so often they break through the national consciousness, and this is what happened in Northern Ontario. You probably remember that it was all over newspapers. It still is to a great degree. Globe and Mail is still reporting on it. Toronto Star is still reporting on it. Eventually, it got reported in the New York Times, other international papers. And what the government do? They called for a meeting. But this wasn't just any meeting. This was a meeting that had the Prime Minister. It had ministers there. It had leading people over at all the different ministries. It had experts from different stakeholder groups, physicians, health policy leaders, etc. And they met and they discussed solutions. And those solutions were supposed to lead to impact. Now, if you look at what happened between the time that the crisis first happened and where the communities are now, the crisis is actually worse. So this must not be what's happening. So what actually happens when you look through the story and you start to ask people about what's happening is that there's something different going on than the cycle in the middle that everyone thinks. This crisis, meeting, solutions, impact that leads to more crisis. Between crisis and meetings, there's something that we came to call side conversations. So side conversations are defined as any conversation that excludes the person that you're trying to impact. All right? It would be like a conversation that you'd have about your son or daughter without your son or daughter present or knowing about the conversation. And this commonly happens in communities. These have everyone talks and we're not included. This really happened within Northern Ontario. So one of the groups that was reached out to by government was the Northern Ontario School of Medicine. And I had a conversation with the medical leadership there, and they said, why are they calling us? We don't know what's going on. So the government reaches out to these groups asking for advice and help. All right? And these groups reach back because between the meetings and solutions, there's a pre-allocation of resources. So Northern Ontario School of Medicine suddenly gets a few $1,000 in order to launch a mental health study. Or some other nonprofit organization that doesn't have strong ties to communities suddenly has the contract to provide all mental health services across the north. So between the solutions and the impact, you're getting the responsibility for implementing everything outside the community. Suddenly everything's being done to us. People are showing up trying to sell us on what's good for us. All right? So in actuality, there's two circles going on here. There's the circle of the crisis, the meeting, the solution, and the impact that we're all a part of, Indigenous peoples. And that's all we're taught to see. But in reality, what's happening there's these side conversations, pre-allocation of funding, responsibility is all being pushed outside our communities in order to implement, which is leading towards crisis. So the question that we had is, why would you set up a system this way? All right. So if you go back to our original statement, systems create outcomes, it actually makes a lot of sense. How can you ever create capacity within a community to deal with its own problems, to challenge discrimination, to fix health disparities, to create equal outcomes when it comes to education, if they never get resources, if they're never part of discussions, and if they never receive any responsibility for implementing things? And what's happening now is that the government is making a shift, and I'm going to give the government credit. They are trying, all right? Now, the government's a big group. Not everybody is all government, right? Just the same as health system physicians and administrators don't agree half the time, right? And the same exists between political, bureaucracy, all these different pieces of the ministries. People don't necessarily agree on how to challenge it, right? And so the reason why this outside circle stays this way is because of the way that the system's set up, but also because ingrained special interests benefit from the outcomes. There are very, very specific groups, both within and outside our communities, that benefit from ongoing crisis, that benefit from these side conversations because they're a part of it. So the question is how do we eliminate the outside circle? Now, if you look at health, health went through several different transformations over the past few years, and they didn't actually take that long. I find it interesting when I get in conversations with researchers about the social determinants of health, and this myth that we've passed along that it takes, a generation to change the social determinants. If you look at a data set as a researcher, if you're saying that it takes a generation for things to change, what you're literally saying is everything in your data set right now has to die. Right? That's literally what we're saying if it takes a generation for social determinants to change. It does not take a generation for things to change. And we have proof from the medical system. If you look at quality improvement, all right, and everybody's probably familiar or at least heard of that term within health. Do you know that was non-existent before 1998? If you actually look at the story behind quality improvement, there's a small group of 30 people that came up with the idea for quality improvement immediately after a big report was published by the National Institute of Health down in the United States called To Err is Human. It talked about 300,000 or so iatrogenic complications that happened within the system. So complications that were created by the people who are supposed to be fixing the problem. All right, so all those deaths happened, and this group said, we're going to fix it. We're going to fix it, we're going to learn the story, and we're going to fix what's wrong with the story. So they went to a large medical gathering, and they challenged everyone that, how would you like to save 100,000 lives within 9 months? That was the beginning of the quality improvement revolution. 5 years later, you suddenly had all these health quality councils spring up across the country. You had legislation passed. The Health Quality Acts are not very old pieces of legislation. They came in around 2002 to 2006 in the different provinces. And now suddenly everybody, not just in North America, but across the world, believes in quality improvement. That happened in a very short period of time, 6 or 7 years. And it's had enormous impact. So to change this story is not going to take a very long time. What it's going to take is for us to understand it and for us to impact the parts that we know can be changed. So I think I have 10 minutes, so I'm going to go back to over here. So what does the medical system believe about Indigenous patients? What are these assumptions that kind of keep this structure in place, that are the argument that our patients, our Indigenous patients, should not receive the same care as other patients in the system? Things like don't care about their health, they're frequent flyers, they're going to overuse the system, they don't understand the explanations, they can't speak English. I've experienced this personally in clinical work, not in Alberta but elsewhere, where I literally had surgeons come up to me and say, don't bother talking to them, they're not going to understand you anyway. And it was major surgery, it was heart surgery. It's important to go through these things with patients. The assumption that people will be non-compliant, the fact that they're going to come in with all these different disorders. And this has led to the creation of a structure that's very, very different than the structure that we have for the rest of our health. So this is a literal representation of the different programs that are provided through First Nation Inuit Health Branch. All right? So there's a big emphasis on health promotion, disease prevention, a lot for public health protection, small little slice for primary care, and then a whole lot for community capacity building. All right? This, on the other hand, is the way that a health region is structured within a major Canadian city. you don't see any of the things that are emphasized within First Nation Inuit Health Branch. You know, although I will never say that public health is not important, it definitely is. Public health, its big claims to fame are vaccinations, and that's about it. You know, that's what public health has made the biggest difference in, is vaccinations and the spread of communicable diseases. Everything else, in every health system, if you're having cuts within a system, where do the cuts go first? Public health. But that's the majority of what we receive in our communities. So how does this translate into what literally happens during the experience of a patient? What does the discrimination actually look like? Well, patients in general can present in 5 ways. They can be healthy, they can be mildly sick, moderately sick, severely sick, or in a sort of medical crisis, okay? Heart attack, super high sugars leading to changes in level of consciousness, etc. Health workers, so any health provider, whether it's a pharmacist, a nurse, a physician assistant, we only really do 5 things. We educate, we observe, we record, we refer, or we do something to intervene, all right? Interventions are only useful if they actually change the disease process, all right? So if I give you a pill and it doesn't do anything, it's kind of a waste of time for me to intervene, all right? So when you look at the mainstream health system and you look at something specifically like diabetes, in the mainstream system, if you're healthy, they tend to focus on education, right? So these are the early diabetic screenings. These are the education programs they have in schools, dietary presentations that they do to people who are at high risk for diabetes or may just be early diabetes. If you have mild disease, they educate you, but then they might observe you a little bit closer, all right? You might have a health professional sit there and say, you know, maybe you should start checking your sugars. Keep like a sugar diary, where you check your sugars every day and you write down what the glucose level is. If you have moderate disease, you get the education observation. They start recording what's going on from time to time. You usually get referred to a physician, and they might put you on some sort of medication, something like metformin or glitazide or something, all right? If you have severe disease, then your intervention accelerates, all right? Now suddenly you're on insulin as well as the pills that they might have put you on before. If you're in a medical crisis, you immediately get transferred to an emergency or some other sort of acute care facility. That way you can be immediately treated, all right? Now, on the other hand, if you're in the Indigenous health system, if you're healthy, you get education. If you have mild disease, they both observe and educate. But if you have moderate disease, you don't usually get the pills, all right? Now, this is a structural thing. How many of you have heard of doctor and nursing days? Anybody heard of those, doctor and nursing days? So when you're actually scheduling healthcare within a First Nation community, you literally schedule absence of care. So you say you can have doctor days for 2 days a month. That's all we're providing. How are you supposed to get on pills if you need a physician to sign the order in order for you to receive pills? You know, or they say, well, we'll fill the rest of the time with the nurses. How are you supposed to get on the medication if the nurse doesn't have the ability to write the medication, or to change the medication, or to increase the medication? Alternatively, you get people on medication for decades who've never had it changed. You know, I've met people who've been on the same dose of metformin for 20, 30 decades with poorly controlled diabetes. It's impossible to stay on the same dose of medication of metformin with poorly controlled diabetes. If you have severe disease, you continue to get the education, the observation, the recording. But then you have to get referred out of the community most times. All right, you have to visit a doctor in the adjoining town. You have to go to the pharmacy down in another town, 20, 30 miles from where you are. And then if you have a medical crisis, there's usually no sort of system set up to actually take you to the place that you need to get treated. You know, if you have a broken leg, you have to phone central processing within Ottawa to get approval to be shifted out to get your leg fixed. You know, you can't get an ambulance to come and pick you up unless you get approval. You know, so this is the systemic discrimination that exists within the system. This is the literal differences between the two. But we're often confused about what we're doing because it's labeled different things, right? Education and prevention doesn't change anything unless it changes patient behavior, right? And so what we're constantly told over and over again when education system or interventions fail is that, well, it's the patient's fault. The communities don't want to change. The communities are resistant. We don't expect this from anyone else in the country. If you come in to see me in Edmonton or Grand Prairie where I practice, I don't care whether or not you believe me or not. I'm just there to provide you care. That's not a standard that you're measured on, but it's a standard that we measure our communities on, our children, our adults. For observation, that only changes outcomes if our observation lead to effective intervention. So if you see something, but you never communicate it to somebody who can actually do something about it, there's no point in observing. You know, there was a mental health therapist who was providing care to a collection of First Nation communities, and they were asked, you know, show us what you've actually done. The mental health therapist said, well, I'm not going to because, you know, patient confidentiality. And the communities pushed back and said, well, we need to know what you've done because we've been told that you're not really doing much. And so they submitted a half-page piece of paper that said, I saw people for many things, did many interventions, and had many good outcomes. You know, there was no recordings or observations about anything. And the system accepted that. They said, well, you have to pay them because that's what our standards are. You know, that would never be acceptable anywhere else except for within our Indigenous communities. Recording only changes outcomes if someone reads our records and it leads to effective intervention. How many people have been seen by people on reserve or have heard about people seen in our communities who can't get their records transferred out? You know, none of those recordings or observations matter if they don't inform the care that you have when you're in your crisis. Referring only changes outcomes if we refer to someone who can provide an effective intervention. Now, this is something that we all share, being bounced from physician to physician, nurse to nurse, hospital to hospital. But now imagine someone who never has any access to any sort of intervention being thrown into that system. And then intervention is only effective if it's something that changes the trajectory of a disease and its outcome. So when we look at defining solutions, and I'll wrap it up quick because I think I'm running out of time, it's Health Canada tells us that our programs will lead to better health if you follow our directions. Public health is the most important part of the health system, and what we're doing works. The reality is that health disparities are growing worse every year, that public health forms a very small part of the mainstream health system, and what Health Canada is doing is not working, and our people are literally dying. So the solutions that are often presented is more research focused on the social determinants of health, argue that it's a jurisdictional issue that we can't do anything, and to blame the patient. It's not our fault that it's not the government's fault or the system's fault that you're sick. But the solutions for mainstream health is to actually move away from research. We no longer count things, we want to apply things. Focus on providing primary care services instead of public health. Say that everybody across the system has to take responsibility for the patient care. You know, it's not just your fault, it's my fault if things don't change for you. And then patient-centered care. So what can you do to change things? So these are some recommendations. Recognize that systems produce outcomes, that the system isn't broken, it works exactly how it was designed to work. And the outcomes are exactly how colonial systems were designed. The second is to move beyond focusing on our moments in healthcare, that one time that we felt that people didn't look at us properly or the time that our appointment got canceled, to instead looking across our patient journey and understanding what other people get versus what we get. Actually understanding literally what the discrimination is. Not to get caught up in outputs. Don't be busy doing work that doesn't change things. You know, if what you're doing isn't changing something, change what you're doing. Outcomes change when accountabilities change, but this requires a change in structural accountabilities. This means that we're going to need new legislation. It means that we need new ministries, which I think we're getting. And that's the only way that things are going to change. I think this is a very exciting time to be a participant in changing things when it comes to discrimination for our people. We have opportunities, and I think we have a society now who's ready to hear that this discrimination exists, that it needs to change. And we do have opportunities to have input and make changes, but we have to make sure that we're effective. Thank you very much.
Thank you for that. So next up, we'll have our relative Cindy Blackstock, who is Executive Director of the First Nations Child Family Caring Society of Canada. She is also the director of FNCARES at the University of Alberta and a professor in the School of Social Work at McGill University. A member of the Gitxsan First Nation, Cindy has 25 years of social work experience in Indigenous children rights. Her promotion of culturally based and evidence-informed solutions has been recognized by the Nobel Women's Initiative, the Aboriginal Achievement Foundation, Frontline Defenders, and many more. An author of over 50 publications and a widely sought after public speaker, Cindy has collaborated with other Indigenous leaders to assist the United Nations Committee on the Rights of Children in the development and adoption of the General Comment on the Rights of Indigenous Children. So please, let's welcome Cindy. Thank you.
John A. Macdonald has been in the news again. He's creating more controversy. This time, not for his love of cocktail, although we know he loved cocktail. A lot of cocktails. Not for his impeachment. And not even for his peeing in the alleys of Kingston, something he was known to do. Something highly correlated, perhaps, to his love of cocktails. He raises an interesting point. People have said, no, you must not strip his name from public schools. That is revisionist history. He must be remembered for all the good things he did. He was one of the founding members of Parliament of the country. He rammed the railroad through to the west. Those are all good things that built a nation. Defenders of Macdonald like to raise the fact, they say, that people of that period did not know any better. They say it as if it's an absolute truth. And I think that they're so certain because they have never read a history book about the relationship between non-Indigenous people and Indigenous peoples, or the actual archival documents of that time. Well, it's true there was racism back then and indifference. That's also true today. Peter Henderson Bryce, one of the public health officials who's actually one of my greatest heroes, in 1907 is hired by Indian Affairs, under then, of course, it was Prime Minister Laurier at that time. But he did a study of the children in residential schools, and he found they were dying at a rate of 25% a year, 69% if you track the kids over 3 years. And the reason for it was health inequity. He could not make out why the federal government was spending 3 times the amount for tuberculosis prevention and treatment in the city of Ottawa than they were for all First Nations across the country. Why could that be happening? And is it surprising then that the death rates were so high in the school, far higher than for the non-Indigenous community? He thought not. He goes back to the Government of Canada with all of his research and details, and he says, you must change this. What does Canada do? It would be improper to say that Canada ignored the report, because they did not ignore the report. The receiver of that report, Duncan Campbell Scott, and above him, Prime Minister Laurier and others, retaliated against Dr. Bryce for being a whistleblower and cut all of his research funding, and said that really documenting the deaths of kids is not something we really need to use taxpayer funds for. After all, the Government of Canada said, Bryce's reforms are far too costly. They would have cost, by Brian Titley's estimate, about $10,000 to $15,000. A paltry amount even then for a country whose annual revenues exceeded $100 million. Truth and Reconciliation Commission says over 4,000 to 6,000 children died, and that is an underestimate. They acknowledge. This whole mythology that people of the period back then did not know is also untrue. because Bryce, confronted with the resistance within government, leaked his report to the Ottawa Citizen newspaper. It was on the front page of the newspaper. Clearly, it was enough to catch the incense of an editor to put it on the front page of a newspaper back then, huh? Front page, and carried in newspapers all over the country, including what was then called the Globe, later the Globe and Mail, all the way to Victoria, the Victoria Colonist. The people of that period, some of them rose up. One guy named Samuel Hume Blake, reading Bryce's report, was so incensed that he said, as a lawyer, he was the founder of Blake's law firm along with his brother. But as a lawyer, he said what Canada was doing was probably, he says, using the words, uncomfortable nearness to manslaughter. So people of that period, at least some of them like Blake, thought that not only was Canada's ignoring of Bryce's report immoral, because back then kids dying unnecessarily was not on a good moral character, it was likely criminal. And that's my question, is kind of like, how is this group of people of the period any different from the people of the period who read Bryce's report? Or the people in government who knew better and didn't do better? It's part of what Alika was talking about too, is that normalization of the system. And we as First Nations have become normalized to these inequalities as well, right? It has become the way that most of us grew up. We were always treated unequally. But the research on the effects of compound inequalities, because on reserve, kids get less across every area of their childhood. So you get less for education, you get less for water, you get less for child welfare, you get less for everything, but you're judged by a society who thinks you get more, right? And by a wide woven, very sophisticated communications regime perpetuated across governments. And even when the Auditor General and others pierce through this narrative that people get more and they show people that people get less, then there's a whole pack of background noise. For example, yes, the government says, we acknowledge there's inequities, but we can't deal with them overnight. How many people have heard that from any government? How many of you think it's a legitimate excuse? I don't agree. It's legitimate. I was going to give you a whole pile of bookmarks. But you know what? Why is it that we're so quiet when they say that, right? Why is it so quiet we say that? Then there's the old background one that First Nations folks can't manage their money. That's why we can't give it to them. They don't have capacity right now to manage the money. And then they will put in the paper, they'll highlight some First Nations person who didn't manage their money or was fraudulent. Now, what's interesting is when those First Nations folks who are fraudulent or in fact criminal or mismanaging their money are found out, that's considered to be a validation of the cultural characteristic that we cannot manage our money. I remember in Ottawa, they were shouting around the First Nations Financial Accountability Act. We all remember that, right? I can't believe how many people thought that was a good idea, right? Especially because I live in Ottawa. And I work at McGill in University in Montreal, where they were marching mayor after mayor out of the mayor's office in handcuffs due to fraud and breach of trust. But how many people said that we should cut the funding for the government of Montreal, federal transfers, because the people of Montreal repeatedly has a track record of electing these people, and we can't trust the white guys with the money anymore. That's how deeply embedded those stereotypes are. That's how it's been persisted for so long. It's most dangerous when it's normalized discrimination, right? That's why this type of evidence by the World Health Organization and others doesn't get through your mind. That's why we get more upset when we see one person or a group of people being persecuted by Donald Trump's administration. But we're almost really comfortable with 165,000 kids being racially discriminated against by our own government. How many people have attended a protest against the racial discrimination against First Nations kids? Well, quite a good people. You're the converted. How many people have gone to see an anti-Trump protest? Around the world, if we counted up the numbers, there'd be a lot more for Trump. Now this is us. I'm getting back to Macdonald because I want to tell you that I actually think that he should be recognized for the railroads, and I think he should be recognized for whatever work he did in Parliament, but I also think he should be recognized and remembered for the deliberate choices he made to persecute Indigenous peoples and the Chinese head tax and a whole pile of other things, right? There's this bizarre thing in Western culture where somehow when you're dead, all of your sins get rinsed from you. Now, it's nice to think about it that way, but I don't think it really happens that way. And in fact, what we've been doing in Beechwood Cemetery, where Bryce and Scott and Flood Davin are buried, is we're erecting plaques that acknowledge both sides of who these people are. So if you're to see Duncan Campbell Scott, his plaque used to just be about glowing terms about all the good stuff he does. And Bryce, who is buried over the hill, had no plaque. So we put up a plaque for Bryce, and then we thought we needed to revise Duncan Campbell Scott's plaque. So it now says Confederate poet and cultural genocide in the same plaque. Because you are not remembered by the obituary your friends write for you. You know, I find obituaries fascinating in Western newspapers, right? These people are angels. Loving parent of, loving family member. I'm thinking, where are these people in the world? And where are all the scandalous people, right? Like the troublemakers like me, right? How do we kind of identify with all the dying people? Because they're all angels, and then there's the scandalous people and troublemakers like me. We're going to be remembered not for what people write about us, but by our actions and our inactions. By staying silent in the face of this racial discrimination, we are making a political choice. There's far more politics in remaining silent in the face of discrimination than speaking out against it. So, there is another inequity that's silent. So we talked about the government funding inequities, but compounded onto that is the lack of voluntary sector services. What do I mean by that? Things like homeless shelters, food banks, kind of recreational clubs. How many reserves have you been on where you found a homeless shelter? Where is the housing crisis the greatest in the country? How many communities have you been where there's a food shelter? Where is the food insecurity the highest issue? Right? 60% of the funding for the voluntary sector comes from the federal government or provincial governments. So you get this compound hardship. You get the short funding on the federal side, and then you get almost nothing from the charitable sector. So it compounds together to even deepen the inequalities. And this is a study I did back in 2001. And my mom always said, you know, when you look at something complicated, look for the obvious because almost no one does, right? It's been obvious those groups have not been there, right? And it's been obvious that the government has not supported First Nations to develop their own charitable institutions. This is Dr. Bryce, and this is the front page of the Ottawa Citizen. Now, it might look a little bit stark, this is 1908, to you now, and you might all think that you would react to it. But my experience is that the people of this period are not very different from the people of that period. People read the papers, they get horrified, but it's not enough to care. Change doesn't happen by caring. You have to do something. And that means you need to affect change at those systems that Alika is talking about. Because the evidence of the impacts of this inequality are profound and well known, right? This is a letter written by a little boy in the Christmas season of 1923. His name is Edward B. The letter is addressed "Dear Parent." We don't know if it ever got to his parents, but you can read the letter yourself. You can see that he and the other boys in the school are so hungry that they're going to be eating cats and they're going to be eating wheat because they're so hungry. And the teacher's treating him cruelly, so the only thing he can think to do as a little boy is to strike back at her next time she does that. Now you talk about the neutrality of public servants. I want to kind of tease that back, because I think at some point we're all accountable for what we do. We do know this letter did go somewhere very important. It made it into the hands of Duncan Campbell Scott himself. And upon reading it, he said 99% of the kids in the schools are too fat anyway, and threw it into the garbage. While he was making these statements, Bryce from 1908 was publishing all this stuff and getting into lots of trouble in the government. In 1922, he publishes a pamphlet called A National Crime. He circulates it all around Ottawa to leaders, etc., trying to call for people of the period to rise up and force the government to change. Edward B's letter, of course, is only a year after The National Crime is published in 1922. And at the same time, what was happening for Duncan Campbell Scott? He was president of the Royal Society, which is Canada's top academic institution. He was getting honorary doctorate degrees, and he received a very warm welcome or retirement party for being a loyal public servant. Now, Bryce was a public servant too, but he was persecuted for doing the right thing. And I saw just the other day that Health Canada veterinarian, or a health sciences person, right, who speaks out about what is happening in that dairy industry, and he is fired by Health Canada. And we, the public, still don't rise up, and these people who are taking these big hits for us, right? You hear about these people who say incremental equality. Okay, well, government can't fix it overnight. We have to just roll in funding over 5 or 10 years. This is a report on education. It was written in 1967. A lot of government reports were written in that year because it's the centennial year for Canada, and a lot of report on Indians. This is a report written by a guy named Alex Sims, and he says, can Ontario afford to wait for the glacial pace of change? He's reflecting back at the many studies before him documenting the inequalities in First Nations education and the failure of those studies to implement the reports, right? 1967. And he's recommending, guess what? Equity, giving control over to First Nations communities. And we, in our work, kind of think these things have not been documented. Had Sims' work been documented, we would not be struggling today to achieve equity in education. We would not have young people going to schools where there literally is no water in the school, right? So what creates change in a system? Is it just goodwill with governments? Is that enough? You know, I think we've seen worldwide that governments don't create change, they respond to change. And that's where the people of the period are so essential. You are literally, all of you, the best hope for First Nations kids. And you can also potentially be their biggest disappointment, as many generations before have done. And part of what I came to realize is that I was part of the system that was perpetuating the problem. I sat with many other First Nations folks documenting the inequalities, sitting with government, coming up with the solutions. They'd send us letters saying how much they appreciate the report, that they're reviewing the report, and they would never implement it, and things on the ground for kids wouldn't change. It was like Alika was saying, you used up official procedure to mask action, right? But we already know the problem. People like Sims and Caldwell in 1967 and Bryce in 1907, they already told us what the problem is. The First Nations communities have been saying, hey, with a little bit of good health care here and clean water, we could go a long way, right? This stuff is not rocket science. So that's why we filed the human rights case against Canada in 2007. And the case winds on for 9 years, but finally the kids won. It is the only legal case we know of in the world where a national government has been found legally responsible for racial discrimination against a whole generation of children. for the inequities in child welfare and also for failing to implement something called Jordan's Principle to ensure that First Nations children can access all public services they need without delays or denials related to their First Nation status. Who remembers when the decision came out and it was covered in the news here? A number of you do. And do you remember when the government came out and they welcomed the decision? Minister Raybould Wilson from the Attorney General's office, Minister Bennett on behalf of Indigenous Affairs. It should have been a joyful day. And what happened in the press? It was covered very well for 2 or 3 days, just like the front page of the Ottawa Citizen and the Globe, and then it went silent. And guess what story kicked it off the front page? Heckling in Parliament. Now, what did the government do to actually change things on the ground, right? They didn't do anything. They accepted the decision so that you would all feel that things were taken care of and look away. But they didn't do anything. Thankfully, the tribunal, well aware of Canada's track record of not implementing these recommendations, including by groups like the Auditor General, held on to jurisdiction. They've issued 3 non-compliance orders against the federal government so far. The most recent one in May of 2017, and there's another pending, probably out this month. The last non-compliance order linked Canada's non-compliance to the deaths of the 2 girls in Wakakapika First Nation that I think Alika was talking about, because there was substantial evidence of inequitable mental health care and how before the tribunal and evidence. Now, there's been some progress on Health Canada finally adopting Jordan's Principle and applying it. And you need to know that if you have a case where a child needs a public service and is not accessing that, you should get onto the website and report it. They have 48 hours to return that decision to you. The regional people in Health Canada and Indigenous Affairs can approve the service, but they cannot deny it. It has to go to headquarters if they're going to deny it. So this is a legal right that all of you need to know. It applies to education, health care, child welfare, every public service. So if you know of a child out there needs that help, we have to thank the tribunal and all of the First Nations and non-Indigenous allies over the many decades who fought for that to happen, particularly Jordan and his family. But we have to take advantage of that. But the non-compliance on the Child and Family Service style is completely unbelievable to me, that there's that resistance. So this is us in front of Duncan Campbell Scott's grave, and in Beechwood Cemetery, and this is the unveiling of the revised plaque. In the end, you know, I was taught as a little girl that really, you know, I'm going to be forgotten. It always surprised me how many people live their lives to be remembered, right? Especially in academia, right? Being remembered, having a big ego when you're being in academia is a good thing, right? Gets you further up the totem pole. That's how you get tenure and all those things. Being remembered. Just think about how much life energy goes into being remembered. And now think about how futile it really is. There were about 1 billion people, over 1 billion people on the planet 150 years ago. Name 5. What if we were putting this energy of being remembered into changing the actions that we have that are egregious so we create a better world for the generations to follow? That they're not struggling to find clean water, that it's everywhere. That the land isn't poisoned, that they can grow vegetables on it and play on it. And that the legacy we leave them is bigger than a Ford truck that will only last for 20 years and be bought by poisoning the land. And what if we left a legacy where every kid was actually growing up on an equitable chance and not judged as if they're a taker and if they're getting more, and if they're not worth the money, or if they're only worth the money 5 years from now, not worth the money right now? Then people like Duncan Campbell Scott, I think, would even rest a little easier, because in the closest thing to a lament that he has ever had, Just before he died, John Malloy, the great historian who wrote a book takes his title from Bryce, which is required reading, I think, for all of you, called A National Crime. He says, Scott says to his publisher, "I have never done anything courageous in my entire life." See, doing the right thing actually takes a lot of courage. I used to get into trouble for doing the wrong thing, and any fool can do that, I'm convinced. But I could not believe the amount of trouble I got into for doing the right thing. It takes far more guts to stand up for the right thing than it does to get into trouble for being the wrong thing. And I think that's what he was talking about. Bryce actually got into a lot of trouble and was forgotten for many years. But now he is on the wall of heroes in many elementary schools all across the country, because he's the type of person that we want our kids to grow up to be, right? You can go to Ottawa and you can see the James Hope and Son, which is where Bryce published his report. And just down the street, you'll find this building, the Booth Building. How many folks have been to Ottawa on the Spark Street? Hopefully you weren't there in the lineups on Canada Day, right, this past year. Well, you know, many of us have lived in homes or places that we have fond memories about, and we have to move on, and somebody new is going to move in, and we always wonder if they're going to love it as much as we love this place, if they're going to change things, or what's going to happen in this house where so much of our spirit and our soul, and those are the people we love, live. Well, this happens to be Duncan Campbell Scott's office. He worked there for pretty much all of his 52-year career. And I can't help but think that as he retired, he wondered that too. But history has a sense of humor. It really does. Because I don't even think Duncan Campbell Scott would have ever imagined that the new tenants would have been It was their first Ottawa bureau. The very best at seeing this inequalities and injustice are not human rights defenders in my age. They're certainly not academics. Because when I look at the academic literature over this last 40 years, there's a whole vacancy of commentary about the government's inability to do better when it knows better, or to even look at the ramifications of the inequalities on Indigenous children. It has often been a description about who we are or the symptoms of the problems, but not at the headwaters of the issue. Who are the experts in seeing this? Are kids. Because kids know that if they see a child who's getting less because of their race, they don't make excuses for it. They don't strike a committee to deal with it. They don't apply to shirk for a research grant. They actually do something. They pick up their crayons and they make a sign and they go to Parliament in the middle of winter every February and they read Valentine's to the Prime Minister. Now, what do kids possibly understand that we, the people of the period, have not really got into there? Sometimes it's not just the kids who have privilege who can really get it the best. It's the kids who struggled themselves. And I'm going to leave you with the story of Harry. He's a non-Indigenous kid. Really didn't learn very much about First Nations folks. Grew up in Ottawa. But he has Asperger's syndrome. He wrote his letter to the Prime Minister 4 times, and each time he'd throw it into the garbage. Because he thought, nobody wants to hear from a kid like me. They'll just make fun of me. No one ever wants to hear me. Teacher each time would go and unroll the letter and ask him to kind of keep it, and he would throw it back. But finally, on the 4th time, she told him about what a difference his letter could make for other kids. Remember I told you about Duncan Campbell Scott and how he said you have to have courage to do the right thing, that he never did anything courageous his entire life. The biggest courage is shown by children, not by adults. They have the highest degrees of moral courage. And when that little boy knew that what he said might help some other kids who are having a hard time, he mustered everything he could. He unfolded his paper and he took the microphone in front of Parliament. And he said this, and this is another thing about kids. They are the best at expressing ideas. I have read many PhD dissertations of various levels of quality, but none of them have reached this degree of evidence to back it, clarity, and heart. Because somehow in Western education, the more boring you are, the more academic you seem. That's another tradition there, right? And the other thing in Western education is the less people that understand you, the more academic you are. I think that's how they get PhDs, because the more obscure you are, if you actually had to communicate this to the general public, people would be shaking their heads. No, but the PhD committee is like that. So little Harry takes a stand and he reads his paper. And he says, "Dear Prime Minister, do you have a cat?" "I have a cat. His name is Micah," because I like collecting rocks, "and he's a boy and he's black." And then he gets right down to business. He says, "Listen to me. If you do not build more schools, you're going to create a crime wave and lose all of your money. Because kids who cannot get a decent education will not be able to get jobs when they're bigger. But they're still going to need money. So some of them are going to have to steal it. And then people in a community are going to get mad because crooks are invading their homes. My teacher tells me you're in charge. So you better man up right now and build more schools. Love, Harry." We all need to have the courage that Harry showed us. And we all need to talk that clearly. There is no excuse in this country for racial discrimination against little kids. There is no excuse for us, the people of the period, to stand silent. And these kids should not have to wait. If we actually have the guts that Harry showed us, a little kid who's 8 years old, we could change things tomorrow. Not the generation like Alika's talking about. I'm not for that either. I'm not waiting 7 generations and leaving a whole pile of kids behind. That's not something I'm going to do. What I want to see Canada do is get the Parliamentary Budget Officer to cost out every area of inequality that affects First Nations kids. And then for government to release a Marshall Plan-like plan to address it. If we can rebuild Europe in 10 years, we can rebuild childhoods in far less time than that. And if we don't, then let every future generation know this about us. We knew better, we could do better, but we had other things we thought were more important and we stayed silent. We are the people of this period. And you're their best hope. So let's not disappoint them this time. Thank you very much.
Thank you. Masi, Miasin, I'm so grateful that I'm here with all of our relatives in order to move forward in good ways, not for ourselves, but for our children and our collective futures together. If our relative Melissa would like to do a quick sweep of possible questions. If not, I do have one here. I do have two, sorry. So question one, what are tangible ways that we can lift up our whole communities, especially our relatives that exist at different intersections of identities, such as gender identity and sexual orientation? Because these folks have additional discrimination of homophobia and transphobia, often within our communities as Indigenous people.
Well, I think there's a display out there about that, Charis. Go outside and go learn about this group. And we have 7 free ways to make a difference at the Caring Society because we believe that caring Canadians, once they know better, want to do better. You can go onto our website and find those 7 free ways, but the most important thing you can do is write to the Prime Minister and say you want these inequalities costed out and addressed while these kids are still kids. And in ways that actually respect the voices of community decision makers. I couldn't agree more. Like I actually get a kind of a visceral reaction when I see another MOU being signed by government or a working table or something like that, because that's more excuses to not help people on the ground.
Just to add to what Cindy said, I think we need to look at the way that we value evidence. When I'm sitting in an emergency room full of people who are sick, I don't need a study to tell me that people are sick, right? If we go out into the streets and we see our people in the streets, we don't need a study to know that there's homelessness, right? And so it's skipping that evidence that society tells us that we need a report or we need some sort of trusted voice or other things. Trust your own stories. You know, one of the things that Cindy said in her presentation that I'll remember is that it's the stories of these children that really led to the change. Mm-hmm. You know, don't be afraid to share your story, but be educated in how you share your story. You know, I think sometimes we sit back and we say, I want my story to be heard this way. That's not the way the world works. We have to sit back and understand how our story will be heard by people and then find a way to make it common. Because unless we find a way to reach out to the rest of Canadian society, we won't be able to have the force that we have. And that's where the impact that Cindy's had, and that's where the impact that I've had in the work that we've both done is having. And build upon the foundation that we've kind of laid out. Trust your stories, but be smart in how you share them. Share them in ways that people can connect. And we all have that ability.
Thank you. So another question is, what do you think about the split of Indigenous and Northern Affairs Canada into 2 separate departments? Will this make a difference for First Nations regarding access to public services?
I don't know yet. It could be a good thing if we could get something needed to change at Indian Affairs, that's for sure. Because if you've got, as the UN Committee on the Elimination of Racial Discrimination just said in its comments for Canada in August of this year, it used the word alarming, that Canada is choosing to violate 4 court orders plus repeated recommendations by the United Nations to continue to discriminate against little kids. I think we should all be alarmed by that. And so something needed to give. It's true that Health Canada was doing a far better job, in my view, of implementing Jordan's principle than Indigenous Affairs. In Indigenous Affairs, I don't see much movement at all. So I'm glad to see that minister is now in charge of that. And hopefully they bring over a whole new group of upper management with fresh ideas and perspectives, and that they really listen to the community members. I've seen so many good ideas at the grassroots level that never get supported. And those, just give them the space. You know, one of the things I think they're worried about is that we're going to screw up. I can tell you we are going to screw up. But for thousands of generations, we survived our own mistakes. We don't know if we'll be able to survive the Government of Canada's mistakes for much longer.
Yeah, I agree that it really depends. This is probably a bigger opportunity than our communities have been given in a very long time. Brand new ministry can really paint whatever picture she wants, but it depends on how that picture comes together. And that often when people work with our communities, they sit there and wait for us to come out and say what we need. I mean, if you have somebody who's in a burning house, you don't stand there and wait for them to come out and go, hey, my house is burning. Can you go to the second floor and grab my dog? Like, you just run into the house, right? And I think we're starting to see some of that infrastructure get built, particularly at the provincial level. For years, provinces said that being on reserve as far as health and education and social programs, it wasn't our problem. Redford government, they decided to make that change. In Saskatchewan, I think they're starting to create some of that change. Ontario did that under Bob Rae. It's all of our responsibility to make a difference, right? And just like was said many times in both our presentations, it's going to be the people in the room here that are the best hope for making that change happen. And we can't forget that change can happen quickly, and it depends on what we do.
Can you talk about the scale of that? And the reason I'm asking that is after the movie, We Can't Make the Same Mistake Twice, I went home that day and wrote the Prime Minister and my local MP. 3 or 4 weeks later, I got a letter from the MP. Nothing from the Prime Minister. So my question is, how do you mount an effective letter-writing campaign? Has it ever been done? If it hasn't, that may not be the strategy.
I think it involves, in my view, like all social movements through the I Am a Witness campaign and other things, we use a variety of things to educate people. I think the more they hear from different people, it does make a difference. We've seen that internally. I think that's why we're starting to see a lot of compliance on the Jordan's Principle stuff, because it is being covered by the media again, right? It's capturing the consciousness of Canadians across all kinds of different diversities. So I thank you, first of all, for doing that. And I encourage you to keep doing it, because it's these different actions that we take, whether we encourage our local media to cover these stories, whether we're talking to our neighbors about it, whether we're covering it in our classrooms, whether we're writing letters, and most importantly at the voting box. We have to make this an election issue, because the government doesn't think that Canadians care enough about First Nations for it to be an election issue. They think that, like if you listen to the dialogue, it's a lot about the middle class, right? Well, I'm middle class. I'm not advocating for people to think about the middle class. I want them to look at the people who are beneath the middle class, because if you raise them, we all win, right? And not just Indigenous people, all the people who are below us. So keep it up. And if you have ideas, creative ideas on how to spread the word, we're really open to listening to that, because this is not about being right, it's about doing right for these kids.
There's three things that can happen, right? We can maintain the status quo, and discrimination is going to get worse, right? We can get forced reconciliation, which is what we get through litigation. That's what we got through the residential school survivors lawsuit, class action. Or we can get voluntary reconciliation. Now, voluntary reconciliation only comes when society demands it, right? And that's the best kind of reconciliation. That's the best way to change systems. Now, when you have a system that doesn't want to change, there's 4 ways that you classically see the change happen. One is through letter writing campaigns to your politicians, so working the political system through elected representatives. You can go marching in the street, create civil unrest. You can do litigation, or you can go to the media, right? Any one of those 4 things is effective. The challenge that we get into, I think, is that as we escalate things, there are other things that happen that make us think things are changing when they're not. All right? MOUs, round tables, negotiation tables, etc. What's important for us is that we continue to escalate until the outcomes actually change. And we can't let up, even though it seems that things are happening. I mean, with the ministries being split, enormous opportunity. But unless things change, it doesn't really matter, right? So the ministries being split is not the win. The win is actually having the discrimination disappear. And that's what we can't lose sight of.
Wow. So mindful of time, our relatives need to be leaving in a short amount of time. So thank you for being here today and for joining us in this very important conversation. Please keep the conversation going. And again, thank you so much from us at iSMSS, Faculty of Education, Medicine and Dentistry, Kenton, all of the relatives here, and I wish you the best. Thank you.